Hello, everybody. My name is Angela Collins, and today we'll be covering the global burden of mental disorders. I chose this particular topic because it does happen to be personal to me, and it is my way of raising awareness. A few years ago, I was diagnosed with general anxiety disorder, which essentially means that I worry about everything all the time for no reason. So this is essentially why I chose this topic to speak of today. So first slide is what is covered. We cover intellectual disabilities, epilepsy, anxiety, which includes, like I said, general anxiety disorder, panic disorder, social anxiety. We have mood disorders such as depression. We have psychosis such as bipolar and schizophrenia. You have substance abuse, which includes drugs, alcohol, and food. So things like anorexia, bulimia, and overeating also are included. And then we have dementia. So some statistics are that our text lists this as affecting about 10 to 20% of the population globally. But we have studies that suggest it could be higher, and especially in some of the lower and middle income countries that may be hit harder. A lot of the times that has to deal with their lack of resources, lack of healthcare professionals, lack of medical or mental health care facilities, lack of funding, lack of treatment options or medications. So and you also may be dealing with some cultural sensitivities when speaking of mental health issues. They may not see illness or a mental health issue as being an actual issue to deal with. Then we can look at the years lived with the disability, which is around 32.4%, and disability adjusted life years, which is 13%. So previously this was underestimated because suicides were categorized as injuries and were not calculated when speaking of mental health issues. And then chronic pain issues such as fibromyalgia or low back pain, for instance, were not calculated in this. They were considered musculoskeletal, even though most of those people that deal with those are dealing with stress, anxiety, and depression concomitantly with that. So, and those issues can create mental health issues. So, we can look at the stigmas associated with mental health, which may be a big part of why the burden is there. When the pictures, you can see that we kind of make light of a lot of these issues. We don't take them seriously, even when we're just speaking in our everyday life. So, calling people bipolar or anorexic or claiming to have a mental disorder when we don't have a diagnosable disorder. So people may not take this actual seriously. And many people are actually uncomfortable when dealing with mentally ill patients or speaking of mental illness. People still see it as being broken or needing to be fixed, or something is wrong with you. It can definitely be tied up with religion. It can be, or spirituality. A lot of people say that it's a sin to be depressed or against God. It can create a lack of understanding from family or friends. And people may not seek treatment because of these issues. They may think they're weak, or they have a personal failure, or they just need to get over it. And they may be told this by their family or their friends or even their doctors. Even when I was seeking treatment for symptoms of anxiety, my healthcare providers did not actually diagnose it properly. So I went many, many years of seeing professionals without being diagnosed. And actually, they would just tell me things like, stop worrying, stop stressing, instead of actually diagnosing it. So once I was diagnosed, it actually did help very much and create a position where I could speak and get better help and better care. However, people who have more severe issues may have fewer opportunities for work, school, or housing. You may find discrimination, violence, or harassment is common, especially for those who have more severe issues. Even in America and pretty much in all the other countries, insurance may not adequately cover treatment for mental health topics. And Mental health topics and issues and treatments are disproportionately underfunded and segregated services. So it may be actually very difficult for somebody to seek treatment. Just a brief note on the history of mental health treatment. It was originally thought to be demonic possessions, and some cultures also may still see that this way. Um, our treatment options in the past have included lobotomies, induction of seizures and comas, isolation, and asylums. This may happen in other cultures or other countries still, especially those who lack proper funding or proper facilities to deal with this. It wasn't about until the 1950s, 1960s era that medications were actually found that could help. So this is still something that's quite new to being thought of as a treatable illness instead of many other things that we've gone over. And finally, what does this mean for public health? Well, we can focus on improving quality of life for those affected, especially when we're dealing with the more serious issues that can create substance abuse issues or homelessness or things like that that actually deal with quality of life. We can work on implementing policies and plans for assistance, so looking at better legislation, better community policies, better things like that. We can, most importantly, raise public awareness that mental illness is actually an illness and it can be diagnosed and it can be treated. It affects many people, and we still think of it as something that is, we only think about the most severe cases like schizophrenia or dementia, and we don't think about it as affecting many, many more people than that. So raising public awareness and dealing with these stigmas actually can go a very long way in helping. We can also support or conduct more research. So as previously stated, research and supportive research is underfunded. So getting more funding or actually being the ones to conduct it ourselves would be a great step. And then, as the picture on the slide suggests, mental illness is not contagious. You can't catch it by being kind. So just working on an individual level of being more aware and more kind and more empathetic to those who have mental illnesses around us, even those we do not know or do not show severe outward appearances. That would go a very long way on a personal note. The last slide is my references and resources page, and that concludes for today. Thank you very much.